medical dilemma.
Welcome back to Medical Dilemma. Again, we'd like to say thank you to our major sponsors, St. Clair's Medical Center, Makati Medical Center, and LifeQuest Training and Consultancy Corporation. Now, going back to our discussion about ED, okay, let's resume at that point where we were interrupted earlier.
It's about recreational use that you don't
about the
prescribe.
recreational use.
We never subscribe to
drugs.
recreational use because sex is always supposed to be an expression of something higher than the animals, and that is what we expect the man, because we are a higher being, to be able to do so. And I think this is where I like to ask Father what his views are on the expression of sex on this aspect.
We can begin by saying that, well, among animals, sex is a matter of instinct. The instinct is for them to be able to reproduce. And so that their species
Will survive.
Doesn't become extinct.
Yes.
Okay? But among humans, although we share that quality of animality, we still have that instinct.
Yes.
That's why whenever we see a beautiful one, something like that, we take pleasure in it. But more than instinct, it is a matter of choice also. It's an act of the free will. That is why when you get married, it's a choice. When you like this person, that person, it's not only an instinct, but it is a choice. I like that. I want to live, to be forever with that woman or with that man. It's a free will. And it is not only because it is, we want to reproduce, but at the same time, it is a social obligation on our part to be able to be connected with one another in a truly loving relationship. Among animals, we have the highest form of love, precisely because love through sexuality does not only tell us of our animality, but it is a divine act, in fact. That's the reason why God made us male and female. And that male and female, it is through that sexuality that one of the highest forms of love can be shown. That is why it is a divine act. It is not just on the lower level of pleasure, no, or instinct. It is in fact divine. That is why God is love. And all sexuality must be done because of love.
So that should answer your question.
Yes.
If there's some sort of permanence,
Right.
long-lasting relationship, then there must be a blessing from God somewhere, and therefore that's what we subscribe to be able to perform in that setting, in that particular area of relationship.
But how come the recreational use of Viagra and Cialis is still quite prevalent from what I see and hear outside?
You'll have to blame society and the media for that, because they think it's more fashionable. It's the real image of macho. I remember the days when smoking used to be the macho image, until we found out that it caused lung cancer and so many heart conditions. Now, the new thing is they have to be fashionable in the sense that they can perform not only with one person but with multiple partners, and that seems to be the idea. And that's the reason why we are very concerned about the call centers, because they're the ones that are propagating all the illicit and illegal sex and the spread of diseases, especially HIV. I mean, on that aspect.
Speaking of drugs, no? You
Yes.
said earlier that there are some drugs that are dangerous to take with this
Yes,
thing.
yes.
However, how about drug addiction? There's sometimes news coming out that it will enhance their performance. Is that true? With using drugs like marijuana and all of those?
Like alcohol, like marijuana, can only do so in a small amount, because it increases your hormones and increases your awareness and increases your sensitivity. But if
Initially,
you take too much alcohol, if you take too much marijuana, you will never be able to get it up. So that is only up to a certain point. But why should you indulge in those things when you can do it naturally? When you cannot do it anymore, then that's where the medicines come in. And the only difference between the marijuana and those things are because these medicines were tried and tested in a controlled clinical trial. That means all the negative effects are listed, and you can see all the effects as it is stated. And that's the reason why it is recommended internationally all over the world.
I see.
So when should a doctor prescribe the use of drugs to cure or reverse ED? There seems to be some line that should be crossed first before it's...
No, they just go to the doctor and they complain that there's a problem with their erection such that they are unable to perform with a regular partner. When I say regular partner, husband, wife, or as long a long-lasting relationship. And from then, we do the examinations, physical examination, focused.
Yes.
Ito pala, no? And then we do the basic laboratory exams. We'd like to find out whether this patient has diabetes, hypertension,
Right.
and which you can easily get in one blood examination and blood pressure, etc. And then we start giving them the medications, telling them you must not take some nitrates and you must be able to withstand some amount of stress. There you go again, stress in the performance, because this might affect your heart. But otherwise, it's as safe as can be.
Does the patient have to go to the doctor the first time that they experience this, or is there a certain frequency that they have to experience ED before they consult a doctor?
Within the 6 months.
6
It must
months.
be a consistent inability to have an erection within the 6 months.
But if it happens, for example, only once in a year,
No,
then
that's nothing. You know,
It
encouragement
happens.
from the partner, and then
stress,
right,
proper
Sabi
diet,
na,
exercise.
you must just have the right milieu or the right environment, so then you're gonna get it. You'll be able to perform again. Now, today there is an on-demand pill, and there is a pill that you can take on a daily basis. So Cialis has come out with a daily pill, 5 milligrams once a day, so that there's going to be spontaneity. Many of the complaints of men with erectile dysfunction is when they need to take the pill. By the way, all these pills are prescription-based. You should never be able to get it
Over the counter.
over the
the
counter
counter.
or in the street corner.
Or from the back
But
of the
alam natin lahat
warehouse.
that you can get it from the street corner because black market is everywhere. But it is an ethical drug. It must be prescribed. It can only be used under doctor's prescription. But today, we have a 5 milligram pill that you take on a daily basis, so that when the time comes that you're going to have your performance, you don't need to take the medicine. It should come naturally. So now they have gone a little further to improve the performance of the ability to have an erection.
There should be no long-term effects of that.
None whatsoever.
None.
Oh, it's been
That's
there.
good.
Viagra started in 1998, and it's been over here for the last
25, 30 years, something
Not-
already.
not-
1998.
15 years from now.
15
years.
uh-huh.
About 15
17.
years. 17 years.
17 years.
But so far, the side effects are very minimal, you know. A little blushing. In fact, ang joke nga dyan when you see somebody with red ears, you've been taking, because
Is that
it increases your nasal stuffiness, it increases the blood flow, yes. And therefore, you get certain blushing and redness in certain parts
I
of the
heard
body.
that there's also the counterpart for women, like a Viagra for women. Is that true?
Generally, for the women, we give female hormones.
Ah, I see. Just the
So,
estrogen.
because in females, there is nothing to erect.
Why not? I totally disagree.
Not in the same,
She's an OB gynecologist.
not in the same
the
context as the male,
Same
as the male
context.
organ. I know that there's the clitoris, but not in the same context.
Yes,
And
you
if
don't
want
need
to
that much.
Engorge, and you're a
OB-GYN,
gynecologist,
yes,
OB-GYN.
yes,
You
yes.
should know that you give hormones, but of course the side effects of breast cancer and cervical cancer is the one that's stopping us from giving it on a regular basis. But yes, for menopausal women, kailangan they need the hormones, but again, that's another story.
You should just
We're
be
here just
wary
for
of
the
cancer.
ED.
Don't just.
Yes.
Okay.
That's
Doctor,
it.
I just want to make it very clear. The smaller doses that you said are available, these are still prescription drugs.
Absolutely.
Okay.
You can never get them without prescription.
Because of
And
the
if they
risk,
do,
the
they
side
should be
effects.
wary of getting
Yes.
something in the black market, as you
Oh
said.
yes, because many of them are adulterated.
Yes,
that means
that's the
they only contain half the dose, and therefore they either become frustrated with the medicine that they're taking, or most probably they're going to take double the medicine with a double chance for side effects and reactions. So it's always better to get the right dose at the right time, so that you have the minimal side effects, because there is no medicine without any side effect. Even your paracetamol, whatever it is. And these medicines will have its effect, but it also has some certain side effects. You can develop hypotension. That means if you take too much, you get dizziness, vomiting, blurred vision, and then hypotension, and then, you know, you get sweating all over.
And that turns off the lady already.
Because
right
you will have to
away.
bring the partner to the emergency room. Instead of a nice evening together, you're going to be spending it into the hospital. Not a nice way to enjoy sex in the hospital.
Your practice, Doc, are there young people, a rising number of people who would ask for prescription drug like this?
Yes.
Even the young?
Even the young. Not as much as the 50 years old and
Oh,
above.
okay.
But even the young are now experiencing. I mean, these are
Oh.
valid. These are
That's why
valid
I asked the
concerns.
question. There might be some already young people who are
Yes.
experiencing ED. And
Yeah,
ED.
because of
Don't
stress and
emphasize
other
the end
things.
too much. But yes, young people, because of the stress of work,
oh,
because of certain sexual practices. They have certain sexual practices
Yeah.
that have demeaned their ability to express themselves. That means pinagtawanan sila ng babae when they had sex because it was his first
First time,
experience with a
yes.
female, and then you know, they made derogatory remarks about the penis. Why is your penis crooked or something like that? Doesn't look nice. And then why is it you haven't performed well? Why is it
And
not-
that's very
it's not
uncharitable.
very uncharitable, but because of those experiences,
Yes.
they now develop a severe psychological problem, and even at a young age, 25, they are unable to perform because of that psychological
yeah.
disadvantage.
So majority or a big percentage is due to psychological causes. Is that
No,
correct?
only
Not
a
really.
small amount. Only a
Small amount.
only a
Just
small
the
amount.
reverse.
Majority are still caused by organic,
So
because
the-
of indiscretion with the food and exercise and smoke.
I see.
see.
Yeah, like good lifestyle.
And good lifestyle,
So
of course.
lifestyle.
It's
So,
the best.
in conclusion, we can say that ED is something that can still be reversed, okay, or maybe stopped from progressing further. Okay.
Absolutely. In
Absolutely.
fact, if Father will allow me, it is just as if you were giving somebody to rise up again from the dead. Just like Lazarus.
Just like
Resurrection.
Lazarus with the Bible.
With the indulgence of Father, yes. Because what used to be dead can now get back to life. And it has brought a lot of men hope, a lot of men to regain back their own
Confidence.
exuberance and confidence
Yeah.
and hope because of this medication. If they use it right, anything, if you don't use it right, will have a deleterious effect on the person.
Okay. Thank you so much, Doctor. It's time for us to close the show. So
That fast?
yes, that's very fast. So let's have some parting
We'll
words
invite you
from
again. Don't worry.
each of our members. Okay, Attorney Sara.
Yeah, well, we learned from the show, Sunny, obviously, that ED can be treated, it can
Yes.
be addressed properly, and it's not something that, although we were laughing the whole time, it's not something to laugh about or stigmatize against.
Yes.
So.
Okay, thank you so much, Attorney Sara. Okay, Dr. Gatchalian,
Well, I'd like
parting words.
Parting words is I'd like to remind everybody that sex, of course, is a wholesome expression of your love. And just like Father, and I'd like to quote Father on this. And the way to prevent this, of course, is to live a healthy lifestyle. Alam na ninyo kung ano yung healthy lifestyle.
Yes. Thank you so much, Doctor. Okay, Father Jerry.
well, to all of those who have some problems with such thing as erectile dysfunction, well, not everything is lost. As a matter of fact, you are still what you are, you're still whole, and the best thing that could ever happen to you is to pursue something that makes you whole, which is holiness, and that is the best thing that could ever happen to you.
At saka Sunny pala, no?
Yes,
If we have viewers who would like to get in touch with our guests, they can also email
Of
us
course,
through
of course.
heavenlycrestproductions@gmail.com,
yes.
diba? Para we can help them, diba, Dr. Ed?
Okay, thank you for that information. Okay. Dr.
Well, as
Sanchez.
for me, I cannot overemphasize the fact that when you do sexual intercourse, it takes two, right? And so I cannot overemphasize the important role of women in a successful
Well said.
intercourse.
Like a gynecologist, OB-GYN should.
Okay, thank you so much, Dr. Sanchez.
Our pleasure.
Erectile dysfunction may not really be a dead-end scenario for men because it can be avoided and even reversed through healthy lifestyle changes. But for the men, do ask yourselves, which is more important, the hardness of your stance or the tenderness of your heart? Thank you for watching Medical Dilemma. Tune in again next Sunday at 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. Help patients and families in crisis. Be aware and show you care. Have an enlightened week ahead of you. Thank you.
Medical Dilemma